Hi everyone, my name is Marshall Hewlett, and I've decided to do my presentation on oral care and ventilator-associated pneumonia. This is a very important topic in the healthcare field, and after doing some research, I found that oral care is seen as important by ICU nurses. But when oral care is performed, it is performed inadequately. And a number for y'all. Only 44% of critical care nurses report of performing oral care. So what was the study purpose? Well, previous studies on the connection between oral care and VAP have been proven inadequate. Did you know that there are approximately 99,955 ICU beds in the U.S.? It's a pretty big number. This study was conducted due to patient safety, and you know patient safety is always the number one thing in a hospital. And what was found was that oral hygiene for ventilated patients can be a task. Many obstacles for doing oral hygiene on ventilated patients include ET tubes, gastric tubes, bite blocks, adhesive tape, you name it. I mean, it provides bacteria a great, not great for the patient, but for the bacteria, it provides a great environment for bacteria to multiply. The hypothesis. Does proper oral care really help prevent ventilator-associated pneumonia? So what was the study setting and sample? Well, during the study, they took 47 ICU patients and they were randomized into two groups. One group would receive standard oral care protocol and the other group would receive a comprehensive oral care protocol. If you were a patient in the standard oral care protocol, the oral care you received was with a manual pediatric toothbrush, a standard foaming toothpaste, and a water-soluble lubricant. If you were part of the comprehensive oral care protocol, your care was done with a tongue scraper, a rotating toothbrush. A rotating toothbrush, by the way, has been proven to work more effectively than a manual toothbrush. You were given non-foaming toothpaste and a moisturizing agent. And it has also been found that effective oral care is done twice a day, lasting 2 minutes. And that's one thing they wanted to make sure that these patients received. They wanted them to receive the same amount of oral care at the same amount of time. So what was the research design? Well, chest x-rays and oral and sputum cultures were obtained once admitted to ICU and repeated every 48 hours. Intracranial pressure, or ICP, and CPP, which is cerebral perfusion pressure, were recorded before, during, and after the first 72 hours of admission. With the 47 patients, 807 measurements were taken. Out of all these measurements, there were no significant changes in ICP and CPP. So what were the results of the study? Well, as a given, oral health did deteriorate in both groups, and that's going to happen because due to all the obstacles, it's sometimes impossible to get in every single crack of the oral mucosa. But oral health deteriorated in both groups, but there were key differences that existed between the deteriorations. In the standard oral care, oral health diminished significantly and did not return to baseline after extubation. In the comprehensive oral care group, oral health diminished, but it later returned to baseline after extubation. Also, no significant deterioration in the ratings on tongue, mucous membranes, gingiva, or teeth over time in the comprehensive oral care group. Okay, implications for nursing practice. Nurses, in reality, have neither the tools nor the experience to perform oral assessments effectively. Some bigger facilities have also begun to employ inpatient registered dental hygienists to assist and perform oral hygiene assessments. Dental hygiene students may someday also find themselves doing clinical rotations as a part of their curriculum. I foresee this happening due to the fact that hospitals are wanting to become more cost efficient with getting patients in and out. And this is the reference that I used. I want to thank y'all for y'all's time, and I hope y'all have a great day.